No, doctor not get to the building at the one. Doctor supposed to be a doctor. The typical Cameroonian mother has drank a lot of things before coming to the hospital.
I agree.
We are not against traditional medication. We just don't know what's in there. You may see something. I don't know if it is from the progression of her disease or if it's because they have taken something else before coming.
What is the hardest part of being a medical doctor?
And there are so many hard things. Some patients may be difficult in terms of not taking their medication, not following instructions, and they keep coming back. In the hospital in Cameroon, what patients don't understand is that you attend to emergencies first. You may see the nurse quickly bring a case to me and say, Doc, please see this patient quickly. And those outside will be grumbling, I was here before. It's not really about who was here before. And if you step out to do something, we have been here since morning, we have been waiting in line, we have sat here for over 2 hours. And I'm like, in case you are aware, I've also been here since morning. I once had a patient who we lost, and the family came to the hospital, collapsed and threatened everybody, and we actually had to hide for our safety. It was a whole thing in the hospital. We were scared. Oh my goodness. But here I am today anyway. Hallelujah. Many people feel like doctors, you're in healthcare, you have so much money, and I'm wondering where they think this money is coming from. When they come in the state of emergency and they will ask for a deposit, a patient will be grumbling, how can someone be dying and the first thing you're thinking about is money? Everything should be done for free. Oh, you buy healthcare, this is a matter of life. Why are you always asking for money? Oh, if you only knew how broke we are in healthcare. Oh. When I just started, I would see someone all alone in the world. Where people are wicked though. How can they leave this man all alone in the hospital like this? And then when you go close to the patient, discover how troublesome they were when they were well. When you're young and female again, you're just assumed not to know what you're doing. And this is from everybody, both your colleagues and your patients and everybody. It makes it challenging to help those that need to be helped. Sometimes it will break me down. I'm quite demoralized. Sometimes patients don't take their medication the way it's prescribed. I once had a patient who came to me as a third doctor. Why? Because she wanted a doctor who was just going to prescribe antibiotics for her. Yeah, I discovered in her book she had gone to the first place, they asked for lab tests, she didn't do. She went to the next place, they asked for the same lab test, she didn't do. I told her, Madam, you see, I'm about to ask for the same lab test. And that's one more thing. Cameroonians don't have healthy lifestyle at all. Few of us exercise. In fact, when we see somebody who exercise, assume the person wants to lose weight.
Yeah.
That shouldn't be so. Healthcare, medicine particularly, you could easily lose yourself. Years could pass, but discover all your life you've been pouring into people and have not really found time to pour into yourself. You lose relationships and fall into depression. Some medical doctors finally may go into drug abuse, alcohol, may become very abusive. In the end, we ask ourselves, was it really worth it?
You've been practicing for some time now, and if you have another chance, would you do medicine again?
Honestly.
Welcome, Doc.
Thank you very much.
It's really good to have you today on this very first episode.
It's an honor to be here. It's such an honor to be here.
Before now, we have actually had a number of conversations and I actually found it very interesting. I'm just so glad to have you here for us to just extend this conversation now to the public.
Yeah.
Right. So tell us about yourself and how you grew up and how your upbringing was like.
Okay. My name is Enoh Ngulle Albright Lena. I'm a medical doctor by profession, a singer. I love happy homes. I believe a lot that the society stems from the home. So I am an advocate for healthy marriages and healthy homes. And I think marriages should be more prepared for, or upbringing should be more prepared for. I grew up in a loving home with present parents. Yeah.
And talking about growing up in a loving home, right? Who has been one of the biggest influence you've had in your life from when you were a child right up to now that you're an adult?
Oh, very easy question. My mom. My mom has been, I used to say that if my mom wasn't my mother, I would still love her for who she is. She has taught me so many things. She taught me discipline. She taught me how to study. Now I'm a medical doctor today, and most of it had to do with discipline and studying a lot. And she taught me how to study. She taught me how to have vision. She taught me how to be disciplined. She taught me how to stand up for myself, and she made me to understand that in this world, you should be aware that you're going to be on your own most of the time. You can't always wait for someone to help you. So that's basically it. She taught me so many things. She taught me the word of God, and she taught me to be a Christian, and she raised me up in the Lord. She raised me up in church, actually. So that's one person that has had so much influence in my life. I think most of the things she has gone through, she doesn't deserve them well. I've just decided to learn from her mistakes and, be a better person than who she was. Yeah.
I remember from the very first time I got connected with you, I think that was 2017 or 2018. One of the things I learned about you was that you're the daughter of Professor Ngulle Emmanuel.
Yes.
And for chemistry students, in our time, let's say we're in class, when somebody says, "Do you have Ngulle Emmanuel?" They are basically referring to his textbook, right?
Yes.
And like one of the things about him is that he has his textbook, I think, complete advanced level textbook that is used nationally.
Yes.
Yeah. And with having that kind of dad, there just comes this expectation, public expectation from people.
Oh.
So tell us about what the expectation was like and how you navigated those expectations from the public.
Imagine being Ngulle Emmanuel's daughter. All eyes are just on you. Back in school, I was called Magic Book. I went to a boarding school. And what I didn't like was the attention. I've always been someone very reserved, my own space. And somehow my seniors already went, "Oh, you're Enoh Ngulle." Oh my God. So suddenly, come and take my plate. "Whoa, Magic Book, come and take my plate and wash. Magic Book, run up. Magic Book, come." And that was the attention he gave me. Concerning academic expectations, like I told you, I was already brought up in a way of discipline and studying. So I didn't really feel so much pressure to do well because personally I wanted to do well. It didn't really matter whether it was chemistry or any other subject. I just wanted to do well in general. So the same effort I put into chemistry, I put the same effort in all my other subjects. I never really had pressure in terms of passing that subject, and I loved it anyway. I loved it. So
Yes, yeah.
it wasn't quite difficult. It was okay, I guess.
I would like you to paint a picture of how good you were at school.
First of all,
Yeah.
I was in a good school.
Okay.
My school was highly competitive.
Which school is that?
Highly. I went to Seka Baptist College, Limbe. Highly competitive, meaning that as you drop by one average, 10 people are kicking you behind. So I began on a shaky scale back in I never failed though, but I was not yet among the first 10, let's put it like that. And I never had average above 60 in the first 4 years. From my fourth year, that's from 4, that's when I started doing better in terms of academics. I think that was because I was more focused on what I wanted to do, the sciences, and I was more oriented. Mm-hmm. So I think I started doing better. Advanced level, I did. Ordinary level, I think I did quite well. I had 32 points on 33. Advanced level, I had 17 points in total, which I think was quite well for 2017.
Yeah, for that year.
Right?
I remember that year. Yeah.
I think it was quite well.
Yeah.
And I think, like I said, I had the best woman it falls back to where I was raised. And also, I went to a very good school. Love my alma mater. I went to good school.
Now you're a medical doctor, but I want to just go back. When did you first think of becoming a doctor, and what really triggered you to be like, I actually want to become a medical doctor?
Okay. Thank you very much. That's a very important question because most of us get to be doctors and we just discover we're here and we don't really find out how did I get here. While growing up, I won't deny I had some influence from my parents. My daddy used to call, my mom said my daddy used to call me doctor and while petting me to sleep, say, doctor, and things like that. So I think that was a dream he had. But they never forced me. They never tried to, you have to be a doctor. Mm-hmm. I just discovered, or they just discovered I'd always been a very curious child, inquisitive child. I wanted to understand how the human body worked and why it worked the way it did. As a young child, I wanted to understand the mechanism of things, why some people are maybe darker than others, the genetics, why people are different, why people's voices are different. I'd always wanted to understand that. Worst was when I got to a teenager, or best say, when I started understanding more things. I wanted to understand the menstrual cycle so much. Mm-hmm. I wanted to understand how the human body worked. So I discovered I was more oriented towards that. So, as it went, I discovered that, same as my studies, the biology was very intriguing. And I was like, I actually can go towards this. Of course, I also had a heart for healthcare. I didn't like seeing people sick. But I think I never really understood the magnitude of seeing people sick until I got to medical school. I had never understood it yet. So yeah, that was it.
One thing we have now is this. We all know as Cameroonians that before you get into med school, there is this general competitive national exams that is supposed to be written. And aside that, the average person does not really know what happens in medical school. We just know it's 7 years. So just tell us about the journey from the very first year to the 7th year and how it's like.
Okay, like you already said, to get into the Faculty of Medicine in Cameroon, we have to write a competitive exam. So for those who pass, you can be enrolled in the Faculty of Medicine of your choice in the country. When you get into the Faculty of Medicine, the first 2 years are preclinical years. So we studied about, we call them biomedical sciences, the basic things that run the body. You have to study anatomy, all the parts of your body. We need to know all parts of your body. We need to know the blood supply. We need to know how it functions. We need to know, how it's normally like. Because, you need to know how something is normally like before you can then recognize, oh, there's a problem here.
Yeah.
Good. From the first 3 years, so we learn anatomy, we learn the functioning. How is urine formed? How does someone know when it's danger? There's something called, the term adrenaline, flight or fight response. Those kind of responses. Puberty, how it comes about, how your body knows that, oh, I'm a boy, oh, I'm a girl. When I get to 13, I should start forming these characteristics. All those things. We get to study how they function. We get to study body tissues. It's called histology. We need to know every part of your body, what tissue is found there, and how they could go wrong. We get to study pharmacology, different drugs. For every drug, we need to know how it works, all the different other drugs that fall under that class, know their names, know their groups and all of that. So those are the few things we learn in the first 3 years. And we are in school all through.
Just theory.
8 to 5 years, 8 to 5 p.m. In the second year, however, we have a brief nursing internship. So we go to the hospital and we are introduced in the hospital how to take vital signs, how to take a blood pressure, temperature, and all of that. So we are in the hospital for a short while in the second year. So that's how the first 2 years, 8 to 5 p.m. every day in school. We write exams at the end of the year and then, okay. From the 4th and 5th year, those are clinical years where we are introduced to human body. Everything we learn the first 2 years, we have to start practicing them. I forgot to mention that in the 3rd year, we begin to see pathology, meaning we begin to see what's wrong. Remember, I told you we need to know how the functioning normally is like. Yeah. Then we need to know what's wrong. In the 3rd year, we begin to have some theory on what could go wrong. Okay, when we get to the 4th year, we begin to apply everything into the patients we see. So in the 4th year, we learn how to ask questions. See, when you come to the doctor's office, the doctor asks you, how are you feeling today? What do you feel? Pain? He asks you, okay, when does that pain start? Where does it go to? How do you feel? Does it get worse with something? Does it get better when you do something? Those are the questions we learn how to ask, because every symptom has particular characteristics, and every characteristic of a symptom has a cause or has a different disease. So we begin to learn all that, we begin to see blood, we begin to know about fractures, different diseases, things we've seen before, things we've never seen before, all of that in the 4th year. 5th year is basically the same thing. We just get better at it. We just, solidify it. In the 4th and 5th year, we still go to school. We have hospital from 8 a.m. to 12, 1, 2 p.m., but we should be at school by 2 p.m. From 2 p.m. to 6 p.m. we have classes. So in the morning, you go to the hospital. In the afternoon, evening, you're in class every day. Wow. 4th and 5th year. And it's in the 4th year that it dawns on us that we're medical students, because we no longer have holidays. No more holidays.
Oh, really?
Because you have to be, no more holidays. Holiday period falls in Christmas, holiday period, Happy New Year. Oh, you're on call. Sorry. No holiday for you, because patients are sick even on Christmas Day, even on New Year's Day. So that's where we, we're kind of dawned on us that, okay, we are really doing this. 6th year, we are more mature. We now stay in the hospital. We're called house officers. We no longer go to class. It's just hospital. We work really close with our doctors in the level 6. They train us hand in hand. They expect us to be more mature. They expect us not to make some mistakes anymore, so they hold us. I do, you do. So at that time, that's where the apprentissage really falls in. The doctor does, you follow. So we follow instructions. We are back to back. We're in the hospital round the clock. That's how we're called house officers. And that's basically in level 6. We're just taught. Also, in level 6, there's a part of the level 6, the first part of the level 6, where we have to go into the outskirts, go to smaller parts of Cameroon, places that don't really have so much healthcare. Number 1, to give our help to the doctors that are there. And number 2, to learn how to be doctors, learn how to respond to situation. It's called integrated health. So we go into all those places to learn how to respond to emergency situations. Like I said, level 6 was, more mature. Level 7 is more about research. In the first 6 years of medical school, there's definitely something you saw that tricked your interest. It's now time for you to research on it. Tell us about, there's a gap in medicine that you should have seen. Tell us about that gap in medicine that you saw and what you think can be done about it. That's what we study throughout our 7th year, and then we defend. Yeah.
I mean, we're talking about training for human lives, basically. You're being trained to handle human lives. And I can imagine how intense and stressful it can be. So what was one thing that surprised you the most about medical school?
I think I already mentioned that the fact that we're like, oh, no more holidays. In the first 3 years, we were in school. When the year ends, everyone will go home. In the 4th year, we were like, okay, as usual, when it's December, it's time for Christmas break. That's where you're like, oh, no Christmas break for you. Yeah. You have to be in the hospital. And that's where it dawned on me that, oh, I really have to do this thing. Secondly, the first case of death I had, it was something that really, traumatized me. I had not seen that in my first 3 years. And then I followed up patient. Most patients don't know how it weighs on us to lose our patients. The carers, the family, I know it weighs on them. But we doctors always desire our patients to have the best outcome. So it hurts us deeply. And unfortunately, we need to move on as quickly as we can to the next patient to help them, because we can't stay crying over one person and there's a long queue of people waiting for you. So that's how it is. My first case of death, my first case of postpartum hemorrhage, a woman bleeding after birth, and she lost her life eventually. And I'm like, oh, people do die after delivery. There's only so much we can do. So it messed up my mind and I needed a while to recover. But yeah, I think it gets better with time. It gets better with time.
And with everything that you're experiencing in medical school, was there any point you wanted to quit where you felt like quitting?
Not really. Not really. I loved what I was doing. Yeah, despite all of that, there was no time I thought of quitting. Yes, there were times I was tired. There was time I actually took a break. I was like, okay, today, please, I have diarrhea today. So let me stay home just for today. There were times like that, but to quit per se, no, not really. Not really. Not for me though, but I do know people who eventually did quit.
Because of that rigor and stress?
Yes, I do know people who did quit.
Oh. So now you've been practicing medicine now for a number of years, right? And I would like you to just walk us through a normal day for the average Cameroonian doctor. Okay.
Really, it's okay. I like the fact that we've rounded it up to the average Cameroonian doctor, because it really depends on where you are. It depends a lot on where you are. So as a medical doctor, I initially started working in Kosala. It's quite a very remote place or distant place. It's found in Kumba. And, that was a place where it was greatly affected by, our English crisis when it began. So that's where I started work. I worked there for 1 year and much more, 1 year and many months before I finally left. The average Cameroonian doctor goes to work in the morning, takes over service from their colleague, if they have a colleague. Because in most health facilities in Cameroon, we have just one medical doctor. So if they have a colleague, they can, go ahead and take over service from that colleague, then start with the consultations. This, again, like I said, the number of consultations per day really depends on where you are. You could have 10, 15, 20, 50, even up to 100 per day, depending on where you are. Generally consultations take place till about 2 p.m. during the day, where most of the patients have gone either for investigations, for echographies, x-rays, lab tests, and all of that. And then about an hour later, they begin to come back. So from 3 p.m., begin to see patient results till whenever you're done, 5, 6, based on how it is. And that's the basic day for a day that's consultations only. Sometimes there are procedures to be done. But when there are procedures to be done, someone may have an accident and you have to try to, suture their own back together. There may be a difficult delivery, such things. So those are the things that may interrupt the flow of consultation. Yeah, so at the end of the day, you could go back. If you're on call, however, you have to spend the night. Spend the night because the hospital always has to have a doctor. So that's in the case where there's more than one doctor in the hospital. Doctor who is on call after their day will have to spend the night. Then the next day, they continue their shifts to a certain time of the day. You have to consult a few patients and then go. Generally, your colleagues will consider if you spent the night, you won't see as many patients, but you still have to be at work. Consult patients, see their results when you're done. Okay, you can call that a day.
I see. Okay. I would also like you to just go ahead and describe how a hospital is arranged in terms of the different departments, hierarchy, and structure, so the average person gets an idea of how the hospital is like in terms of that.
Okay. There are 4 main branches of medicine. 4 main branches. We have pediatrics, that's children. Everything about the child falls under pediatrics. We have internal medicine. Internal medicine has to do with the non-surgical problems of an adult. Say people with liver diseases, heart diseases, hypertension, diabetes, and all their complications. They fall under what we call internal medicine. Then we have surgery. Anything that has to do with the body being breached, either an operation or a wound, a chronic wound, or trauma, someone falls, fractures, and all of that. They fall under surgery. And then we have obstetrics and gynecology. That means the woman, the female genital structure, and the woman and her child, the pregnant lady. That's obstetrics. So those are the 4 main branches of medicine. A hospital is generally built around that, except it's a specialized hospital. So if a hospital says it's a pediatric hospital, of course, it will be meant for children. But generally, a hospital should have what we call maternity, that's women's ward, children's ward. Then you have the medicine, so for both adult, male and female. Then you have surgical ward. That's how a basic hospital in Cameroon should be. From the structures, we have doctors. We should have as many doctors as we can, as many nurses as we can have. We don't have many, but we can just have as many as we can have. The administration basically depends. It depends on, the origin of the hospital. In Cameroon, we have government hospitals, then we have private hospitals, we have mission hospitals. So it falls under that. Basically. So that's how it should be.
So when a patient comes to the hospital, right, I would like you to walk us through from the point where they come to the hospital, the various processes they'll need to follow till when they are discharged. Let's say somebody had an accident and is rushed to the hospital, or somebody had a burn, or somebody has a pain and he comes to the hospital. So what processes or what steps does the person go through from the point of arrival or admittance to the point where they are now discharged?
Okay. We attend to patients based on emergency. So a patient that has a problem that is an emergency, we attend to you first. You come and go straight to the emergency. Immediately we begin to do the procedures that should be done. For example, a patient has an accident and is bleeding profusely. Immediately we have to do what to do. We have to find a way to stop the bleeding, because that's what take the patient's life away first. Stop the bleeding, stabilize the patient, give them some fluids. You're losing blood, so we have to find a way to give you what you're losing, right? Good. The patient will come to the pain. Based on how severe it is, we will know, right? The patient has to let us know. Or when we see the patient come, we'll know, okay, this person is in severe pain or not. We could calm down the pain, also based on the cause. There are some causes of pain that have to be acted on immediately. For example, a heart attack. A heart attack is not a pain where you give pain medications. Immediately has to be solved. So based on where we are. So for a patient who doesn't have an emergency, let's say for that, coming to the hospital, firstly, you're going to go to the welcome unit of the hospital. You come in and we'll see you, take your vital signs. Vital signs are important. Let us know your blood pressure, your temperature, your weight, and all of that. Yeah. From there, you can go and see the doctor that you need to see, based on your problem. If you have a problem that needs to see a specialist, you go straight to the specialist. However, if you have a problem from a pain, a headache, or if you don't even really know what exactly your problem is, because generally, most patients don't know the specialty their problem falls under. And that's why they come through us general practitioners. We now let them know, oh, you have a heart problem, or you have a liver problem. You should see this specialist based on their problem. So when they consult. And like I said, our action is based on how urgent it is. If we see you and discover that it's urgent, we indicate it's urgent, we attend to you immediately in order to save your life. If it's not urgent, okay, we go to the normal process. Generally, all patients either go to the laboratory or, do some form of imaging, ultrasound, x-rays. I said all patients, that's not true, not all patients. Some diseases are what we call clinical diagnosis. We see and we know this is what's wrong with you. Give medications and then you go home. So that's basically how it is.
What is the hardest part of this job, the job of being a medical doctor?
There's so many hard things. But the first is when your patient doesn't do well. You remember I told you that we like it when our patient comes, we give our treatment and it works, right? So it's a bit hard to see patients coming back because, the treatment you've given them is not working. You have to think all over, is there something we're not doing right? Is there something we're missing out? That's something that can be quite hard for every doctor because every doctor wants their patient to get well. That could be a very hard thing. Losing a patient too, that's quite a hard thing to have. We don't like losing our patients. We don't. So that can be quite a hard thing. Having a difficult patient too could be quite a hard thing. Sometimes you have to explain to some patients. Some patients may be complicated. Some may just deeply really want to understand what's wrong with them. And you have to take your time to explain to them. No matter how many more patients you have to see, you have to take your time to explain to the patient. Some patients may be difficult in terms of not taking their medication, not following instructions, and they keep coming back for not following instructions. So those are one of the things we have to deal with every day. So yeah.
And sometimes maybe a patient might have consumed a particular drug, it does not tell you that is what they drank.
So many, especially phytotherapy, that's traditional medications. We are not I will not say we are not against traditional medication. We just don't know what's in there. So we try to tell our patients, the typical African patient has drank a lot of things before coming to the hospital.
I agree.
Yeah, the typical Cameroonian mother, before she has come to the hospital, trust me, she has taken a lot of things. And sometimes you don't really know what's there. You may see something, I don't know if it is, from the progression of her disease or if it's because they have taken something else before coming. So we'll just try our best to tell them, to help, to tell them to tell us as much as they can. It's important to always tell your doctor whatever it is. Don't be ashamed or bothered about what it is. All of us are more interested in your outcome rather than in what you took or what you did. We're not really interested in all that. Generally, we'll always know in the end. We'll find out, but it's always good to just make our job easier from the beginning and just tell us, please.
With patients like this, patients can be very stressful. I know. It's from the medical doctor. I know how stressful people, or the kind of stress people can give you normally. Then now as a doctor again, I would like to just tell me some of those experiences that you've had in the hospital you will never forget. You're like, oh my goodness, this happened. Yeah, so tell us about some of those experiences, some of those crazy experiences.
Let me start with a simpler one first. Patients who find it difficult, maybe have been sitting outside the consultation room for hours. You see a case where we've been consulting since morning, and if you step out to do something, we have been here since morning, we have been waiting in line, we have sat here for over 2 hours, and I'm like, in case you are aware, I've also been here since morning. So it's not like I've been somewhere in one resort waiting to come here at 10 p.m. We've all been here since morning. But like I told you, attend to emergencies first. What patients don't understand is that in the hospital, you may see the nurse quickly bring a case to me and say, Doc, please see this patient quickly. And those outside will be grumbling, I was here before. It's not really about who was here before, it's who needs to be seen before. before that. So that's one of the things we always try try to help them. We are very few in healthcare. We can only do so much in Cameroon. So we try our best to be as fast as we can, but we can't be too fast. We're dealing with human lives. So we have to take our time for every patient, listen to them fully, as fast as we can, and attend to the next person. However, it can be sometimes difficult if those outside are grumbling already. The second thing is how patients respond to grief. Now, that one, we understand it completely. I once had a patient who we lost, and the family, when it was a whole thing in the hospital. We actually had to hide for our safety, and it has happened a couple of times. But one of those experiences that I'll never forget was a patient carer came to the hospital armed, the cutlass, and threatened everybody, and we all had to hide. And we hid for our safety, but we understood. We understood it can be very heartbreaking to lose someone whom you didn't expect to lose at the time, didn't expect to lose. And yes, there's people that expect to lose their patients, so they handle it better than something sudden, especially when it's a young person. So we understood, but it doesn't change the fact that we were scared, and patients respond sometimes like that. So yeah, that's basically it. Those are the experiences that I'll never really forget. How I felt that day. Oh my goodness. But yeah, I am today anyway. Hallelujah.
Most times we, the normal people, we are out of the hospital. We really have no idea what's really going on in the hospital, right? So I'd like to just share with me those things that normal people like me who are out of the hospital don't see and don't know that goes on in the hospital. For example, one thing about patients or the normal person, they have in their head that these guys are making money. So why are they putting us pressure to pay and stuff like that?
Oh, if you knew how broke we are in healthcare. Oh, if you only knew. That's really an important point to me, because many people feel like doctors, nurses, you're in healthcare, you have so much money. And I'm wondering where they think this money is coming from. I'm wondering, because honestly, it's not like that. What the patient sees is how much they are spending, not how much is being used on them. You see, so most patients come to the hospital after spending everything everywhere else. And somehow it's in the hospital where we're expected to give everything for free. Forgetting that this hospital has running costs. We pay electricity, we use devices. We have electricity, we have drugs we pay for. Most of these drugs are imported. We have devices we use. So these are things that are expensive. And patients can only help us by paying for what they can, if they can. I dare say some can, but just choose that the hospital should not be, that place where their money should go to. So it makes it quite difficult for us sometimes, because people assume you're in the hospital now, I should take care of us for free. Why everything should be done for free. Oh, you buy healthcare, this is a matter of life. Why are you always asking for money? And I'm like, no, it's not about asking for money. It's that we need something to run. Right? We need somewhere. If you come and we're able to attend to you with drugs, you should be able to pay for those drugs so that we can attend to the next person in order for it to happen. And all of these salaries and, remuneration for the healthcare workers is excluded, because before what we have can come out of it, we first of all need what the hospital can run on before now what we can have. And somehow patients don't seem to maybe understand that. So that's one thing that patients, we face a lot of problems with. And one thing about patients is when they come in a state of emergency and maybe we ask for a deposit, a patient will be grumbling, how can someone be dying and the first thing you're thinking about is money? Actually, every single doctor in Cameroon can tell you, a patient that you help in a state of emergency, immediately the emergency is over, acts like you were not needed. In most cases, a patient will, is it only for that thing that you're asking for this amount of money? And I'm like, oh, but you're about to die. You were not talking a few minutes ago. You were bleeding. You're almost gone. And then we did everything we could. And you're back. And then, what we did seems like something, it no longer seems valuable. But when it's time to pay for it, it becomes difficult to pay for it. That's why in some hospitals, you see us insisting on something before we start, just because we just want to have something. If not, because in the end, when we have done what we have to do and the patient doesn't pay, we cannot hold you there. Most of them will end up going. It happens to many cases. Most of them end up going. And what can we do? So you see, most hospitals have a policy that at least a certain percentage, it can't come all at once. A certain percentage should come in before we do what we have to do. I've had a case of a lady who had a ruptured ectopic pregnancy. That's a pregnancy that's out of the womb. You have the womb, you have fallopian tubes, and you have the ovaries that produce the egg. So that egg, when it goes to your fallopian tube, that's where it's fertilized. It's supposed to leave the fallopian tube and go to your uterus, where it implants and grows. If it stays in your fallopian tube is a small tube. If it stays and implants there for one reason or the other and grows there, that tube can rupture, and then it leads to bleeding, and it's an emergency because patient bleeds quite fast and could go into shock. So this patient came immediately, and like I already told you, it was a matter of emergency. We immediately took her to the theater, and what was done had to be done, And we're done and everything. And she said, oh, no, she cannot pay for this. Her husband has to come and pay. And I was like, but you're able to pay for it, right? And somehow, maybe they had some matrimonial issues, which I do not really want to know the details of, because it's important to see your patient as your patient. So I do not really want to get into those things, but discover that, this patient may or may not be truly able to afford this surgery, but has decided to wait for someone else to pay the surgery. And it's stalling on us. Now we are forced to wait, and all of that. She finally paid eventually anyway. But I've had so many cases where they truly cannot pay. So many. It's not just one or two. There are actually cases of people who come to the hospital. In fact, the fact that they delayed so much to come was because they truly couldn't pay. And such patients, we won't hesitate to help them. We will attend to them. We will do what we have to do in order to help them get better. And then if they somehow cannot pay, generally we encourage them to pay what they can. And then when they pay what they can, we look at effort. We look at, the patient's response. The patient who is trying. And when you pay what you can, we'll let you go. What can we do? We have done what was important, which was keeping you alive. So,
wow, I can imagine how frustrating it can be sometimes when, after you've done your best to save this person, the person turns out not even interested in paying. What's the big deal? Am I supposed to pay 50,000 for just this small stitch you did on my body?
Exactly.
And with this work you do, how has this work changed your life and changed the perspective you have about life generally?
I can say this experience of mine has made me to see life differently. First of all, it has made me to understand how feeble we are as human beings. Someone will be healthy right now in front of you today and then have a drastic motor accident and suddenly can't do basic things on his own. So it made me realize how feeble truly we are. And it made me understand how much we should value this life we have. It's important that while you're alive, find God's purpose for you, work according to it, and try your best to be as present as you can be in people's life around you. One thing I've noticed a lot in the hospital is people in the hospital, when a patient is hospitalized, I know the difference. We in healthcare know the difference between someone who is loved and someone who isn't. We also know the difference between someone who gave love while he was well, he or she was well, and someone who didn't. Because patients in the hospital can be sick for long. But I've seen cases where they're all alone. When I say all alone, I mean all alone. And you may dig into the picture and discover that, this person was actually quite troublesome when they were well. And that's why it's difficult for people to reach out to be of help to them when things are hard. You see other people who, fall into their lowest and they have so many people around them to help them as much as they can. You can feel, the hospital is one place where you can know when someone, like I said, gave love to those around him. And that's very, very important. While you're well, it's important to treat people around you very well. It's very important. You never know You never know. Those around you, your siblings, your family, your children, and it's mostly about family. You'll be surprised. You will feel like family should be family should be there for each other in times of difficulty. You'll be surprised at how family can abandon one another in times of difficulty, either because, that's how family is, or just because of the behavior of someone when they were well. So it's something. At first, at the beginning, when I just started in fourth year, I would see someone all alone in the world. I'd be like, where these people are wicked though. How can they leave this man all alone in the hospital like this? And then when you go close to the patient, discover how a patient can be. No, don't touch me here. No, don't do it like this. No, I don't want it. So you discover, I understand why. It's difficult to care for you. And it will take an extra amount of love to care for you. So it's very important for us to like I said, to be very close and to be present for each other when we are fine. You never know. Honestly, you never know.
Wow. As a young medical doctor and a woman again, I know you must have gone through a lot of challenges working at the hospital. So just tell me about some of those challenges you've had working at the hospital as a young female medical personnel.
Yeah. When you're young and female again, you're just assumed not to know what you're doing. And this is from everybody. Both your colleagues and your patients and everybody. So it takes a lot of courage, to, I don't want to say prove to them, because I tend to tell myself that I'm not really here to really prove to anybody. I'm here to do what I came to do. And I believe in myself. I'm very conscious that I'm, a work in progress, constantly making progress to be better than where I was. And I'm very, very confident in when I learn how to do something and how to do it. But the challenge is, those around you. If I'm constantly seen as someone who is young or inexperienced or doesn't know, it makes it challenging to help those that need to be helped. So those are one of the challenges I mainly face. I just want to say that that's one thing that has just helped me. Sometimes it will, break me down, and I'll come home and be feeling quite demoralized. Other times I'll just, get up on my feet, and I actually have to get up on my feet every day anyway. So just get up on my feet and, keep going. I won't forever be young. I won't be young forever. However, will keep building me, right? However, I have to start from my youth. I have to start from my youth and, be growing. So I'm just conscious of it that, okay, I'm here for a reason. I'm here to learn. I'm here to gain my experience. I'm here to, build on my portfolio. I'm here to learn so many things. I've learned so many things already, and there's so much more to learn. So in as much as these challenges come up, I try my best to just get my head up the way they say, and then just keep going.
Tell me about some of those specific scenarios where somebody literally gets to minimize you because you're a lady.
Yeah, there are so many of such. I've had several scenarios where a patient will come into the office, a patient or a colleague even, come into the office. Oh, it's you. I thought I was going to. Is this doctor not around? Like, no, the doctor's not around. And then it's about to go. I'm like, I'm the one now to ask, okay, what do you need? And they say, oh, I actually needed this thing. And I'll be like, but why didn't you just speak up initially? So it makes me really feel bad, But I don't, bring it up as a whole big deal. I understand. So when I see them, I have seen quite a couple of cases where after, I've maybe consulted a patient or I've given a review on something, they'll go out and just look for the nearest meal ever and ask again, or show the prescription of what I did, or, you understand. Wow. And so it's, when I see that, generally I'll not make a fuss out of it. I'll just understand and move on to just understand that that's how it is. And I'll not be like this forever again. So I'm going to keep growing, keep getting better, specialize eventually. And I think maybe at a certain level, it's going to get better. I think so. I just see it, and what can I say? I don't make a fuss about it. It makes me feel bad, to be honest, very bad. But yeah.
I can imagine how it can get sometimes. Back to medical school. When you guys just start the clinical years, when you start having classes at the hospital, I know there were definitely a number of times where you did some things that were quite embarrassing, and you were like, "Oh my goodness, why am I doing this?" Do you mind sharing some of those?
You know, before I got there, when I became a medical doctor, and I started seeing medical students and the things they were saying, I understood that. Oh my God, was I this naive? That's when you become a bit lenient, because you understand that just beginning, and you're like, so I used to be like this. A personal experience I had that I will never forget. Maybe I've done other foolish things, quite a number of them. A personal experience I had was that I once, let me give you a little context. In medicine, there's something we call hysterectomy. We could remove a woman's womb, her uterus, for one reason or the other. It could be many causes. You could have many fibroids. You could have what we call endometriosis. We could have a woman that is bleeding, so much bleeding after delivery that we need to, remove the uterus in order to save her life. So there was a lady whom we had actually done that procedure for. And I was in my 4th year. In the 4th year, when we just come into school, they teach us an outline of how things to be done, an outline of questions to ask patients, how to examine the patient from head to toe. Touch like this, measure this, touch this, and all of that. And one of the measurements for a woman that's in the maternity generally is to measure her fundal height. So that's the height of her uterus. When a woman just gives birth, we need to know how the womb is reducing with time, because it should reduce with time until when we no longer can feel it, through the abdomen. So by routine, any woman post-surgery, we would measure. The fundal height was this. That's how we call it.
How do you measure?
We use a tape. From her pubic bone, we use a tape and we measure the height. And it should reduce by a certain amount of centimeters every day, 1.5 to 2 centimeters per day, based on a lot of things. There are a lot of things involved. So I measured it, whatever I measured, as usual for that patient. And when I was done presenting, I was so confident I was done. Like, isn't this the patient whom her womb was removed? Did she have a hysterectomy? Like, what did you actually measure? And I was so embarrassed. Like, oh my goodness. Just the routine. Yeah. And I didn't think. So it's with time when we grow as adults or as big doctors, as we begin to see overall, we stop doing things because of the routine. We begin to see changes where things should be done. I once had a classmate whom I heard, or a junior mate whom I heard, had measured the pulses. The pulses are, when you put your hand in the vein, you feel this tup, tup, tup. Yeah, that's what we call your pulse. The pulses on the feet. He went ahead and reported, the pulses on the feet of a patient. He reported, well, examination done. And the lecturers were like, isn't this the patient was amputated and open and there's no leg? So why did you take the pulse on the leg for a patient who has no leg? The stories are endless. So when our medical students, our professors deal with a lot. So they just, we could fail for that anyway, because it's important not to just report things like that. Because how can you miss out that a patient is missing out a leg? That's very dangerous. So apart from that, many other things, but that was what really marked me. Yeah.
Like, I can just imagine the pressure when you just start your clinical years. You've learned about the theory from the first 3 years, at least most of the basic stuff, right? And you're now in your clinical years and you are now in the hospital. So there are times where you have to do things like you've told me. You're being taught by your professor, your teacher in the hospital with real patients. So there is this routine. Okay, they have told you that when the patient comes, do like this, do like this, do like this, do like this. So you're bent on checking those boxes.
Yes.
And it's with checking those boxes now you have issues. Wow. Okay. So There was this thing you told me in the conversation we had before this podcast. You mentioned there was this guy, this guy who was drinking with his friends. Then he had an accident, and then his friends now brought him to the hospital. Just tell us about that particular.
I was telling this story was about the how patients can be quite ungrateful. This patient came drunk. I cannot forget this day because this was a Sunday. I was at work on Saturday during the day, Saturday at night, Sunday morning, and I had just gotten home. Just about to eat, and then my phone rang. Oh my goodness. Again, let me call dog, serious bleeding, please just come back. And when I heard my colleague, she was literally shaking over the phone. So I understood, oh, this is something serious. I called back, I said, what is it? Because I knew for the time for me to get there, I have to tell her what to do before. She said, oh, there's someone here who has had an accident and is severely bleeding. I asked where. She told me it was somewhere around the thigh here. I said, okay, look for napkins. There are napkins. Put it there. Put pressure on it. And wait for me till I'm there. So she did as I said. She put pressure and held. Then I ran and came. Then I had to call my other colleague to come. And then we came together. Immediately, there was no time. We took that man immediately to the theater. Since it was a deep cut, we had to try our best to, search. He was a rider and he was drunk. So he had an accident and it's like one of his glasses shattered and the pieces had gotten into his thigh, deep into his thigh. Luckily, he had not cut any major vessel, like any major blood, a vein or an artery. It would have been more catastrophic. The bleeding was coming from the muscle itself. So we had to go in, look for the particles, take it out, and when such is happening, generally we like to let whoever is with the person know that is how bad it is. But when the patient came to the hospital, first thing we did was try to get to the people around him. So they didn't know that, oh, this person is in the hospital, they should start coming. Of course, we have started the response, but there's someone calling. We took his phone. First of all, his phone had the battery was a Tronco phone, the battery with rubber. So that's what I understood who we are dealing with. And they would take the phone and call, no airtime. So we had to take our own phone, begin to be selecting numbers. None of his numbers were stored. We had to go to the call log and begin to call people. Nobody was speaking. Nobody was picking up. Finally, some lady picked up, whom we assumed to be his wife, picked up and said, oh, your husband has had an accident, he's in the hospital. All this while he's drunk and anesthesia is not working on him because he has taken alcohol so much. So whatever anesthesia we're giving. So finally, it's the alcohol that was his anesthesia because anesthesia wasn't working on him anymore. So all of this while we're still working, removing the pieces of glass. We call his fellow drunken friend. Since no family member is there, call his fellow drunken friend to come. And instead of him being focused on what we're doing, he keeps saying, how could we have an accident after drinking just 2 crates of beer? He used to drink even more and he drives and gets home safely. And we're wondering, but what kind of friend does this man have? So we finish and we call his supposed wife. We tell him, oh, okay, come to the hospital. She comes to the hospital. She doesn't bring a dime. She comes, she looks at him, sees him, and she says, oh, she has a newborn baby and she can't spend the night. And she goes home. And we're wondering, but this man is going to spend the night in the hospital alone. And yes, he did spend the night in the hospital alone. I spent 2 more nights in the hospital alone. His drunken friend, nowhere to be found. His wife, nowhere to be found. Finally, he ran away. One day we just discovered that he had run away.
Oh, really?
He did. With that leg. Like that. We had done what I had to do, done the dressing, and he still ran away. So that just made me to understand one of the things this thing has taught me was the quality of the person you need to be and the quality of the people around you. It's okay not to have a dime on you. It happens. It happens. But you should have your phone. It's not possible that we'll go through all your call lists and we'll call people and there's no one that can come for you. It's such a sad thing. He was in the hospital for 2 whole days, nobody passed. And then he said on that Sunday where he was drinking, he was from a meeting. I'm like, okay, so this meeting, there's nobody in that meeting that is concerned about the fact that their meeting member had an accident immediately after the meeting. And I'm wondering what kind of meeting you're in, what kind of friends you have. I have quality friends. If I fall here, I have people I can call and they'll stand up for me. So I feel really bad when I see such cases. That's one of the cases that made me my eyes to be more enlightened. I was more grateful to God. Thank God I have people around me If I'm 4 years today, or if the year I'm somewhere, I have people that can run to me to look for me and sustain me. Like I said, it's okay not to have money on you. I mean, during the time when we're doing that, he never had any dime on him, and that was not even the issue. We're looking for somebody to be there for him in the hospital and somebody to also be able to start up with the bills. But he had none. And I felt, for someone in his 40s, he stayed in the hospital. He never took a shower because he didn't have what to change into. Finally, we had to look for a random lawn in the hospital. One of my colleagues helped to clean him up and then change him the next day. It was such a sad thing. Such a sad thing. And I was wondering, how are people really living? Remember, like what I told you, people should really try to be intentional about how they live, because the day it will happen, you really don't know. And that's where you're really going to know the quality of life you have lived so far. So yeah. By the way, that lady said no one believed he was in the hospital because he frequently calls and tells people he's in the hospital. So they send him money for him to go and drink. That's why he called and nobody came. So it was so sad. That lady apparently has had a child with her, and because of his behavior, she has decided not to have anything to do with him again. That's why she came. She initially thought he was lying. When she came and saw him, she just left and never came back again. It was such a sad thing. Yeah.
And you just mentioned surgery. Yeah, as the average Cameroonian who is not into medicine, we know that there is a medical specialty called surgery, right? So in our head, okay, only surgeons perform surgery. But I've learned so far that general practitioners also perform surgery. So could you just tell us about it? What kind of surgery do medical doctors, general practitioners perform, and what kind do specialists perform, surgeons perform?
Okay. In this case, I told you this was a case of a deep wound. Yeah, so it was more of a case of a suturing, putting some tissues back together and helping. That a general practitioner could do. Now, surgery should be done by surgeons. Yeah, that's the safest and best way. They are specialized. They have worked on it. They have studied on it. So surgery should be done by surgeons. All kinds of surgery should be done. Every kind of surgery has a surgeon that is specialized to do it. However, in Cameroon, we just have a handful of medical doctors. More, not to talk about even a smaller amount of specialists. How much can they really do in Cameroon? So imagine we're somewhere deep in the woods, deep in the forest, somewhere in a village right in the periphery. And we have this kind of case where someone has an accident and deeply bleeding. But before they get the next bike, because you know there are places in Cameroon where they have access only by bikes, if at all they have access by bikes. Secondly, they have access only during the day. As from 5 p.m., you no longer see any bike. So imagine there's someone somewhere in such a case who has had an accident, or there's a woman, someone who is in labor and she needs an emergency cesarean section. You, the doctor, you sit there and you're like, okay, where will I see a bike to carry this woman from here to the nearest district hospital, which is about 2-3 hours away, with the road the way it is? Will he or she survive? So what we do is, at that time, we weigh the cost of things. Patient's life versus wanting to refer the patient to the nearest hospital. Now, most of the general practitioners, or no general practitioner, works on their own. The thing is, specialists, like I said, specialists are only a handful, and specialists need particular equipment. Most of these villages can't even handle basic electricity, not to talk about handling the equipment that specialists really need. So there's only so much they can do. So they work hand in gloves with us, general practitioners, in order to do what we can do for the emergency cases. But if the patient is not in a life or death situation, if it's not an urgent thing, and if it's something that is also very, very critical, a surgeon should do it. So that's basically it. General practitioners are allowed to do some simple surgeries in case they're life-threatening. But normally a surgery should be done by a surgeon. Yeah.
I see. That makes a lot of sense now. Are there times where you leave the hospital for a very stressful work day, just come and sit down and start thinking about your life?
There are many times. I started working on the just recently. There are many times when I'll come home and I'll be like, in my work stool like this. There'll be times I'll be so exhausted from work that I'll not even be able to eat, not even be able to talk. The other day I went to see my mom and she was talking and I wasn't responding. And she said, I can see you're so exhausted. I was like, yeah, I was so exhausted I couldn't have a conversation. All I needed to do was sleep. So I said, I'm like, this is my life I've chosen like this. Will I be able? Let me look for my specialty that will help me to specialize fast. So that it has happened like that. It's happened like that. So that day is like that. But what do you have to do? You just have to get up and keep going. Get up and keep going. Yeah.
And as a doctor, and that's you now, doctor, and me, the normal person, there are a lot of misconceptions we have about medicine, the hospital, and doctors in general. So many of them. We just talked about one where the average patient thinks that hospital has money. So why are they focused on collecting our money instead of saving our lives? So could you just touch some of those misconceptions that we have about the hospital, medicine, and doctors in general?
Okay. Another misconception patients have is that when they go to a hospital the first time and maybe don't feel better, it means either the hospital is a bad hospital or the doctor was a bad doctor. Now, there are a lot of things I would like to clarify. When I see a patient that has been to a previous hospital for the same complaint or a previous doctor for the same complaint, and I ask them, but did you went here this day, right? Yes. You complained, right? Yes. You started treatment, right? Yes. Why didn't you go back there? They say, oh no, the treatment they gave wasn't working, so I decided to change hospital. I was like, no. Patients in medicine, we have what we call a scale of work, meaning we don't always start with the worst. We start with the simpler problems and begin to ascend, right? If a doctor prescribes a medication to you and you feel it doesn't work, let's talk about from the end of the healthcare practitioner. It's only right for you to go back to who prescribed that medication to you. Why? Firstly, we may have prescribed the lower dose based on how you presented the case to us, and it may not have worked just because the dose wasn't optimal at that time. It's important to come back to us and tell us that, oh, this medication you gave, I still feel the pain, or I still feel the complaint. Like, okay, we should add the dose. Secondly, when you come back the second time, it could make us think, oh, maybe it wasn't it, or maybe it wasn't just it. Like I said, we don't just start from the worst case scenarios. I'm going to give an example. Someone having abdominal distension, that's stomach swelling. Someone's stomach can be swollen and it may be something as simple as bloating. It may be something as complicated as cancer. We don't go straight to cancer. We start from the simpler things, go to the investigation step by step, and then begin to gradually go to the more complicated things based on how we see. And that's why it's important to have one place where you're followed up so we can see the progression and we can know when you go to somewhere else, you make them to start everything all over. And most patients don't keep their records. They go somewhere else, brand new book, brand new everything, and you have to start from scratch. And then they still complain, I already did this test too, I already did this test. Okay, where's the result? It's important to follow up, to stay in one place. Let your primary healthcare practitioner take care of you where you are, unless they refer you and tell you that, okay, up to this level I've discovered is this. You now need to go to this next level of healthcare because this is where we can end. So it's very, very important for patients to understand that. When I see patients that come from elsewhere, they generally feel like we'll do something else. I'm like, you've come here, I'm going to do the same thing because it's you. You've not changed. Your problem has stayed the same. So it's not like I'm going to do some form of magic, in order to change it. I once had a patient who came to me as the third doctor. Why? Because she didn't want to do investigation. She wanted a doctor who was just going to prescribe antibiotics for her. Yeah, I discovered in her book she had gone to the first place, they asked for lab tests, she didn't do. She went to the next place, they asked for the same lab test, she didn't do. I told her, madam, you see, I'm about to ask for the same lab test. You can't just prescribe antibiotics like that. She was looking for someone who just prescribed medication for her, and it couldn't go like that. Finally, they left and didn't come back. Maybe they went to the fourth hospital to find somebody who will just prescribe medications for them. It doesn't work like that. They say, a step of how things are done. So it's important for patients not to, assume that because they went somewhere and they don't feel better, it means that place is a bad place or it doesn't work. No. it just happens that it's important for you to give the follow-up. It's important for you to come back and say, oh, doctor, you gave me the medication and it hasn't really worked. Sometimes patients don't take their medication the way it's prescribed. You know, we explain a lot, and you'll be surprised that a patient will leave your office and has understood absolutely nothing of what you have said. Yeah. How do you know? Ask them again what I just said, and you'll be surprised. You see. Yeah. So most patients don't take their medications in the right way, in the right dosage. And, those are things that we need to check the next time they come. You see, it may not really be their fault. They may not just have not understood how you explained it to them. And sometimes we are not even the ones that give the medications. We prescribe it, they go to the pharmacy. Maybe they even have a mix-up. They say this medication is maybe 3 times a day. Maybe they end up mixing up and taking the one that is supposed to be 3 times a day, once a day, and then they come back and they've been undertreated, and things happen like that. So it's really important to go back to where you started your follow-up in the first place. Yeah. So that's one of the things that is a huge misconception.
The average Cameroonian basically is living under the poverty line, and they don't take health care seriously. Even middle-class families, they don't take their health seriously. For example, from the last time having a conversation, you can actually count the number of people who have health insurance in Cameroon, right? They are a very small number of people who have health insurance in Cameroon. And when they now fall into a medical condition that's pretty demanding, it now becomes stressful in the family, where they would start trying to borrow money, or they'll just be very frustrated with the financial burden that comes on them because they couldn't afford health insurance, and they can also afford now to just get the money out. And sometimes, like you said, some will run away, some will not really care. So just talk to us about the whole health insurance thing and how the average Cameroonian can better cater for themselves health-wise.
Okay. I just think Cameroonians just need to be more conscious. Health insurance sometimes affiliated to people who have jobs, work under particular companies. But the job market in Cameroon is quite broad. A lot of people are in the blue-collar jobs, so a lot of people don't have offices. A lot of people have their personal businesses and here and there. So Cameroonians, the majority of people even run like that. Few Cameroonians work in, renowned companies or agencies where they can have those health insurance. The rest of the Cameroonians who are not affiliated with such need to just be intentional about their health care. Just need to be intentional. Again, this falls back to money. The basic average Cameroonian thinks, oh, why should I go and be giving 5,000 francs or 10,000 francs a month for a health disease that I don't even have? Instead of using that money, to do one or two things. They have so many things they need to handle at that time. Have to play Njangi, they have to pay school fees, they have to pay house rents, there are so many things they have to do. They have to feed. So to remove the amount of money to keep for health insurance, it looks a bit, not what is important at that time.
Yeah.
However, that's why it becomes a problem, because eventually when they don't need the money, it doesn't go anymore. It doesn't work again. They will now, things will become difficult for them, for their families and for them. So I just want to say that the average Cameroonian just needs to be intentional about their health. We just need to let them know. You see that Njangi that they play, they could decide that Njangi will be their health insurance. That Njangi will be their health insurance, both for themselves and for their families. Just so that, if you have something you need at the hospital, you could help yourself. The average Cameroonian also needs to learn how to do health checkups. Very few Cameroonians go to the hospital. They tell you, since I was born, I've never come to the hospital before. Or you see, I'm going to give you an example, hypertension. Hypertension is a disease that is mainly asymptomatic, shows no symptoms until you could suddenly just have a stroke. Yeah, suddenly a heart attack. Before you realize, they start saying, oh, he has been complaining for headache for some time now. It's been a couple of years. Once in a while, when he comes back from the market, he'll have severe headache. And he'll be like, oh, it was the sun. The sun was too hot. Whereas he has been having hypertension for so long and not knowing. Whereas if you had health insurance, or if you did frequent health checkup, even if it's just once a year, you went to the hospital, they could tell him when his blood pressure started rising, diet modification, exercise, and all of that. And that's one more thing. Cameroonians who don't have healthy lifestyle at all. Few of us, exercise. In fact, when we see somebody who exercises, now wow, run, you're doing well. All those comments, I'm like, or if they see someone exercising, assume the person wants to lose weight.
Yeah.
That shouldn't be so. Everybody should exercise. It should be a daily lifestyle, not because you need a particular objective. In fact, there's a particular objective to stay healthy. So those are basic things that are help to prevent a lot of disease. But since, like I said again, it still boils down to the poverty line. Many people really don't have the means and don't have the knowledge about how important it is to save up for the rainy days. And when those rainy days do come, it's sad because they can barely meet up.
Okay, you've been practicing for some time now, and you've gone through the rigor of medical training, and here you are now practicing. If you have another chance to pick a career, would you do medicine again?
Honestly, no. Healthcare, medicine particularly, healthcare in general, you could easily lose yourself. Years could pass and your life is in the hospital and you're wondering, but okay, what have I been doing? Of course, there's a certain form of satisfaction that comes in, but discover all your life you've been pouring into people and have not really found time to pour into yourself. That is, the good thing about this new generation, you see, there are a new generation of medical doctors who are trying their best to do other things. And that's maybe why our parents maybe see us like we're unserious. Because we're trying to, exist. We're trying to be something else out of being a medical doctor.
Yeah.
So you see a medical doctor who is really involved in music, a medical doctor who is involved in acting, or someone who is involved in content creation and all of this. And our parents will be like, no, doctor not get to the doing that they want. Doctor supposed to be a doctor. And that's because we are trying to keep our mental health safe. You see, a medical doctor can easily lose themselves. You see, so many years have passed and they fall into depression. Oh yes. They fall into depression, they fall into serious sadness because they're wondering they're trying to understand what they've been doing for all these years and they can't know. You can fall into the routine so much. You're always in the hospital, then exhausted, then you sleep, then the hospital, then exhausted, then you sleep. We lose relationships over this. We lose time to spend time with people. And sometimes in the end, we ask ourselves, was it really worth it? Was it really, really worth it? For some people, it may have been. For others, it may not have been. I found my way to navigate through to them. But if you should ask me, will I go through this again? Now, some medical doctors finally may go into drug abuse. Some go into alcohol. Some may become very abusive. Some may become very abusive because of that trauma. Some may become very isolated. Some cannot have a basic conversation with someone else if it's not medicine. So you discover that they are somehow no longer, let me call it, oriented. Yeah. Some have difficulty adjusting with their family. They have become so used to being in the hospital and in that kind of environment that they find it difficult to sit with their wife or their children or their family members and have a conversation because they don't know how to go about it. Yeah. Some have to, like I said, go into alcohol, and somehow it becomes, something they use to cope, and it may end up, taking away their life. But it's not something that's really brought to light a lot because, at least they're surrounded by their colleagues who can, help them, try to help them out of it. And that's why it's very, very important as a medical doctor, right from when you're a student, to try your best to balance it out. If you try your best to balance it out, okay, it may truly, truly help. Hobbies, your personality, who you are or who you could be, who you are apart from the profession. If not, you end up losing yourself.
Wow. Okay, now, aside your work as a medical doctor, what do you enjoy doing when you're not working?
Very interesting question. Okay. I enjoy trying new things in general. And this is not very specific. So long as it's something I'm doing for my first time, I find intrigue in doing things I've never done for my first time. I enjoy traveling. Oh, I love that so much. I travel a lot for my at my level.
Okay.
I do move a lot. I enjoy the process of living from one place to another. Yeah, I travel a lot. I enjoy singing too. In fact, I do sing a lot. But I enjoy singing in harmony. So those are things I really find myself enjoying doing. And now I'm trying to venture more into content creation. I think I enjoy that too. Yeah.
And as someone who likes traveling, what's your favorite place in Cameroon?
That's quite interesting. Where's my favorite place in Cameroon? That's quite interesting. I think so far my favorite place in Cameroon has been Limbe. For those who have known me, they know I love the seaside. Me and sea again. You know, when I posted on my me and water again.
I think I saw it.
Yeah, so I actually like it a lot. When I go there, I feel, great. I feel free a lot. So you see me fighting to go to Limbe and go by the seaside, or going to Kribi to go by the seaside, just because I like that part of nature. That I enjoy it a lot. I enjoy the water too. So being both on the sand and inside the water too. Yeah.
And it just has a way of making you relax after a very stressful
It has.
week.
It does. It has. I really enjoy that a lot, When we're in the sea and they say, oh, the wave is coming, jump up and drop. And they'll go under the wave, we'll go under. I love it so much. It makes me really feel relaxed. And I just get time. I also get time to think a lot when I'm there. I don't just walk around and see the sea. It kind of helps me to have a quiet space. One of the things I like doing too is walking. I didn't say that. I like walking actually. I walk for a hobby. So I sit and like, oh, I should take a walk. And I do. Nice. I just put on some earphones and I walk for some distance and I walk back home. I actually do that a lot. So when I'm at the beach or at the seaside, I look for somewhere, sit on a rock, and it helps me to, put my edges together. I used to have something, I used to call it life check. I used to have sessions of like, I'll sit down after a couple of months and be like, okay, what am I doing? How far? Is there anything I'm working on? What have I been? Have I been lazy? And things I would like to, kick back off. So that's how I generally do.
All right. So as we round up, I'd just like you to, I'll shoot you two things. You pick one of them. Right. Tea or coffee?
Coffee.
Water or a drink?
A drink.
Njangi or savings?
Njangi.
Okay. Going out with friends or staying at home alone?
Staying at home alone. Staying at home alone.
All right. It was really amazing having you on this particular episode. I know you'll come back. I know you'll come back. I mean, the conversations we have had, even behind the recording, I think they have been very meaningful. And that's been why I thought in the first place that many can benefit from these conversations. Yeah. And I'm looking forward to having you on other conversations. And thank you so much for coming and accepting our invitation for this podcast. And we have a little gift for you.
Oh, so that was for me.
All right. So this is from our team.
Oh, thank you so much.
Of appreciation.
Thank you very much. Oh my goodness. Thank you. I like receiving this. Thank you very much.
Looking forward
to having you
on the next one.
Thank you so much. I'm grateful. It was an honor to be here. Thank you.
I think that's it.
Thank you very much. Bye.
Don't